Hello friends, welcome back. In this part 2, we are going to discuss about radiological age estimation from the elbow joint. Previous session we have seen the age estimation from the shoulder joint. In the elbow joint, there are 4 centers in the lower end of humerus. One is the medial epicondyle, other is the trochlea, this bigger part is the capitulum, this is the lateral epicondyle, right? This is the medial epicondyle, this part is the trochlea, right? Then center for radial head, this is the medial epicondyle, trochlea, capitulum, lateral epicondyle, center for radial head, and center for tip of olecranon process. Coming to age of these various centers, appearance, fusion, etc. The lower end of humerus, medial epicondyle, that appears. This is the medial epicondyle that appears at 5 to 6 years. Fusion with the rest of the diaphysis that occurs at 14 to 16 years. It fuses separately. Then comes the trochlea, that projecting part, right? This is the trochlea up to here. This is the round one, is the circular one, is the capitulum. Trochlea appears at 9 to 11 years. If we keep a T for 10, that is the average, then 9 to 11 years we can somehow remember. Then capitulum, that round one, that appears at 1 year. Generally the center starting with the C, like a capitulum, capitate, like that always start early compared to other centers. So C for child, if you remember, child is from 1 year, so 1 year. Then lateral epicondyle 11 years, that can be remembered by lateral LL for 1 like that, so 11 years. So 5 to 6 years medial epicondyle. Medial number of letters is 6, so 5 to 6 years. Trochlea 9 to 11 years, capitulum 1 year, lateral epicondyle 11 years. This trochlea, capitulum, lateral epicondyle, when all the three have formed, then they fuse with each other to form the single conjoint epiphysis, as we have already seen in the upper end of humerus. Okay, single mass. That formation of this conjoint epiphysis involving these three centers except medial epicondyle, that occurs between 14 to 16 years, similar to the age of fusion of medial epicondyle. That conjoint epiphysis fuses with the shaft at 16 to 17 years, right? This is how this medial epicondyle fuses separately. It doesn't take part in the conjoint epiphysis formation. Appearance 5 to 6 years, fusion 14 to 16 years. Whereas all three formation conjoint epiphysis at 14 to 16 years, the same age, but fusion 16 to 17. That we have seen in the previous X-ray. Elbow joint fusion for the lower end of humerus and all 16 to 17 years, right? Head of the radius, appearance 5 years, fusion 16 to 17 years. Tip of olecranon passes 9 year, fusion 16 to 17 years. Olecranon 9 letters, we can remember by 9 years. Here you can see the capitulum, which first appear in the ascending order that we see 1 year. Then head of the radius, what year I told, 5 years, 1, 5. Then comes the medial epicondyle, 5 to 6 years appearance. Then comes the olecranon passes, 9 years, followed by trochlea, that is, as I told, T for 10, 9 to 11 years. Then comes lastly this lateral epicondyle, 11 years. This is the ascending order as far as this appearance of ossification center from capitulum to lateral epicondyle involving the upper end of radius or head of the radius and the olecranon also. So this is the medial epicondyle as we have seen, which appeared not fused in this X-ray as clearly seen, whereas except medial epicondyle, remaining three, trochlea, capitulum, lateral epicondyle, joins in the formation of conjoint epiphysis between 14 to 16 years. Here all conjoint epiphysis has formed but not fused. So above 14 years, fusion occurs at 16 to 17 years. Now above 14, less than 17 years, right? For medial epicondyle appeared above 5 years, not fused, less than 16 years, as far as medial epicondyle is concerned. So this can be remembered, these all the 6 centers can be remembered by the mnemonic CRITO or CRITO. C for capitulum, R for radial head, I for internal, that is medial epicondyle, then trochlea, O for olecranon, then E for external or lateral epicondyle. But for my convenience, I have changed it to CRIOT to remember the ascending order of appearance that we have discussed here. So C for capitulum 1 year appearance, then radial head, that is 5 years, then that is I for internal or medial epicondyle 5 to 6 years better, then O for olecranon 9 years, then trochlea 9 to 11 years. Crito, if you take that mnemonic, it is 9 to 11 years trochlea, then followed by the olecranon, which is 9 years. For convenience, I changed this as CRIOT. O for olecranon 9 years, T for trochlea 9 to 11 years, then external epicondyle, lateral epicondyle 11 years. Now, what is the age of this? Here, as you have seen, in the lower end of humerus, nothing is here. Head of the radius, tip of olecranon not formed. So what is the first bone to appear here in the Crito? Capitulum. So age is less than 1 year. Capitulum itself not appeared. All the centers also not appeared. So we make the tabular column similar to that we have seen in the shoulder joint in the part 1 of the video. Please see that tabular column and draw the table accordingly and deduce the age and give the opinion. So all the centers have not appeared. First center capitulum itself not appeared, less than 1 year. In this, capitulum just appeared while remaining centers not appeared. So age is above 1 year. Since radial head is not formed and medial epicondyle also not formed, less than 5 years, right? Especially the radial head 5 years, less than 5 years. 1 to 5 years is the age. Here radial head has formed. Capitulum has appeared. Capitulum 1 year, radial head has appeared. Radial head 5 years. But after that, medial epicondyle has not formed here. That is the medial epicondyle. That is not formed. So 5 to 6 years. Above 5 years, less than 6 years, or 5 to 6 years, because medial epicondyle has not formed, radial head has formed. 5 to 6 years should be the age. In this X-ray also, you can see capitulum, medial epicondyle, head of the radius, all appeared. So above 5 years. Medial epicondyle 5 to 6 years, above 5 years take the lower limit. But the olecranon not formed. So above 5 years, less than 9 years should be the age here. In this X-ray, you can see capitulum, the ascending order capitulum, radial head, medial epicondyle, but olecranon not formed. But trochlea appeared, right? Actually, olecranon 9 years, trochlea 9 to 11 years should have formed. Here, it is trochlea has been seen, so 9 to 11 years, age is above 9 years. Olecranon process tip not seen, so less than 9 years. So age should be only one, we can say as 9 years like that. In this situation, we have to rely on ossification activity of other joints. Okay. Sometimes that order may be missing. Here you can see that trochlea appeared. Here arrow point out trochlea appeared, but tip of olecranon process is not seen in the olecranon fossa, right? So it is not visible. So it gives a confusion here, as trochlea only formed, olecranon not formed. So in the situation, rely on other X-ray signs. Coming to this X-ray, this olecranon process is seen above this tip of this olecranon ulna, upper end of ulna. You can see a round olecranon process here. That means above 9 years, right? But trochlea is not seen here. So above 9 years, less than 11 years is present here. So capitulum appeared, radial head appeared, media epicondyle appeared, olecranon appeared above 9 years. Trochlea, that projection part is not viewable here, not appeared. So above 9 years, less than, below 11 years should be the age here. Trochlea is not visible here. In this X-ray, all these including this lateral epicondyle also appeared, right? Trochlea is seen. Tip of olecranon process also seen. All these are seen. So age is, as far as this concerned, but age we can determine, but let you know this, where is this lateral epicondyle position is. This should be the lateral epicondyle, a thin area above the radial head. Laterally it will be seen. That is, lateral epicondyle has appeared in this. So age is above 11 years. This is the lateral epicondyle. This is the radial head. Appeared, not fused. Lateral epicondyle also appeared, but conjoined epiphysis has not formed here. So less than 16 years here, right? So 11 to above 11, less than 16 we can say. Media epicondyle also appeared, not fused. So age is certainly 11 to 16 years. This is the olecranon process appeared, trochlea appeared, capitulum appeared. All these conjoined epiphysis has appeared, but trochlea is seen separately. It is not fully formed. As far as the tip of olecranon is concerned, you have to look always for lateral view of the elbow joint. If you see at the AP view due to overlapping shadows, we may miss it. Always, ideally, we have to see for lateral view. Here, the arrow points that the tip of olecranon is just appearing, right? It has well appeared, but not fused. So, above 9 years, less than fusion not happened, right? So less than 17 years the elbow joint, we can say. Here also appeared, it is fully formed, size is full, but it's not fused. Here appeared as well as fused. So age, as far as this is concerned, since it is appeared above 9 years, fusion 16 to 17, right? Above 16 years, right? Here the above 16 years should be the age, as the fusion occurred in the elbow joint above 16 years. In this X-ray, you can see what is the age. Pause the video and find yourself the age. Here only one center in the lower end of humerus, that is capitulum, so, pointed by letter C encircled, that is present here. Capitulum alone present, whereas radial head is not appeared. So age is 1 year, above 1 year, less than 5 years. This also, radial head is not found, only capitulum is seen. Above 1 year, but below 5 years. This is the capitulum. Find out the age. Here, apart from capitulum, this head of the radius also appeared. Head of the radius certainly seen. So, above 1 year, above 5 year, but the medial epicondyle, the ulnar side, is not appeared. Medial epicondyle is not appeared in the ulnar side. So, age is less than 6 years. So, above 5, less than 6. Why 5? Above this head of the radius appeared 5 years, less than 6 because medial epicondyle not appeared. So 5 to 6 years we can say the age here. This is the capitulum, radial head. This is the medial epicondyle has appeared here. So 3 centers are seen. That is, media epicondyle also appeared above 5 years. But olecranon not appeared here. So above 5, less than 9 years should be the age here. See, the olecranon is not seen in the olecranon, the fossa. In this, you have to see any radio opaque shadow is seen in this area. It is not seen. So in this X-ray, we are seeing this medial epicondyle has appeared, not fused. Trochlea has not formed, only capitulum is seen. Lateral epicondyle has not formed, but the head of the radius has appeared, not fused. Olecranon is not appeared, right? So what is the age here? Only capitulum is seen, media epicondyle is seen, head. So above 5 years, olecranon not appeared, 9 years. So age is above 5, below 9. So in this X-ray, if you see in the lower end of humerus, capitulum appeared by 1 year, head of the radius appeared 5 years, media epicondyle appeared not fused, above 5 less than 16, trochlea, which is generally overshadowed by this shadow of ulna, upper end of ulna, that is appeared above 9 years, media epicondyle appeared not fused. Olecranon, as far as this concerned, if you see the lateral view, this olecranon has appeared not fused, right? The lateral view. Again, lateral epicondyle appeared, but it doesn't take part in this conjoined epiphysis. So in the lower end of humerus, all the 4 centers are seen, but media epicondyle not fused. Other 3 centers, trochlea, capitulum, and lateral epicondyle, they have not formed the conjoined epiphysis. Head of the radius appeared, not fused. Olecranon appeared, not fused. So what is the age? Age is above 11 years because lateral epicondyle has appeared. Age is less than 16 years because media epicondyle has not fused. And this conjoined epiphysis, that also not formed, which occurs between 14 to 16 years. So age is less than 16 years. So above 11, less than 16 years is the age here. The age. What is the age here? In this X-ray, you can see all the 3 centers, that is capitulum, trochlea, lateral epicondyle, seen as a single mass. That means conjoined epiphysis has formed above 14 years. Medial epicondyle seems to be seen, but not fused with the shaft. So less than 16 years, right? This has appeared above 14 years. Head of the radius appeared not fused, less than 17 years, right? So what is the age here? Above 14 years, less than 16 years because media epicondyle is not fused. Above 14 years because conjoined epiphysis has formed. In this also you can see the conjoined epiphysis has formed above 14 years, media epicondyle not fused, same age like the previous X-ray, that is above 14 years but less than 16 years. Head of the radius appeared not fused, olecranon appeared not fused here. This conjoined epiphysis has formed. In this also you can see the conjoined epiphysis has formed. You can see the olecranon process tip appeared not fused here, right? Tip of olecranon appeared not fused. That means less than 17 years, right? Less than 17 years. The same age for all these X-rays, above 14, less than 16 should be the age. In this X-ray, as you have seen, all the centers have appeared as well as fused. Conjoined epiphysis also formed and fused. So age is above 16 years because the fusion of conjoined epiphysis 16 to 17, head of the radius, tip of olecranon, all fused. So above 16 years should be the age. Similarly, this also of adult, age is above 16 since all the 6 centers have appeared and fused. You can see tip of vertical line also fused here, the lateral view. Here also another adult X-ray showing these all the centers lateral view. Lateral view should be looked for mainly for tip of vertical line, whether appeared, not fused, etc. So with this we have come to this conclusion of this uh, session. Thanks for watching. We will see with the wrist joint age estimation in the next part 3 video. Thanks for watching. Bye.